My name is Sarah Johnson, and I've been a night shift custodian at Harborview Medical Center in Seattle for 22 years. I clean hospital rooms after patients are discharged, mop floors and empty hallways, sanitize surfaces that will be touched by hundreds of hands the next day. I work from 10 p.m. to 6 a.m. when the hospital is quiet, when most patients are sleeping. When the daytime chaos gives way to nighttime stillness, I'm invisible to most people. Doctors and nurses pass me in hallways without acknowledgement. Patients don't remember the woman who emptied their trash or cleaned their bathroom. I'm part of the infrastructure, like the lights or the heating system, noticed only when something goes wrong. But on September 8th, 2023, I started seeing patients who weren't there yet. Transparent figures lying in empty beds, ghost images on blank monitors, people receiving care in rooms that wouldn't be occupied until the next day. I was seeing tomorrow's hospital census 12 hours before it happened, and I was the only one who could see them. Harborview Medical Center is a level 1 trauma center in downtown Seattle, part of the University of Washington Medical System. We treat everything: car accidents, gunshot wounds, heart attacks, strokes, surgical emergencies. The hospital never sleeps, but the night shift has a different rhythm. Fewer visitors, dimmer lights, a kind of peace that doesn't exist during the day. I'm 55 years old, born and raised in Seattle's Central District. I've worked cleaning jobs since I was 16, office buildings, schools, hotels. When I got hired at Harborview in 2001, it felt like winning the lottery. Good pay, benefits, union protection. My daughter was in high school then. This job paid for her college. I'm good at what I do. Thorough, reliable, invisible. I know every room, every hallway, every supply closet. I know which doctors leave coffee cups in break rooms, which nurses write thank you notes, which patients need extra blankets or an extra kind word. 22 years of night shifts teaches you to notice things, the rhythm of the hospital, the patterns, the small changes that signal something's wrong. So when I started seeing ghost patients, I noticed immediately. September 8th, 2023 was a Friday night. I clocked in at 10 p.m., got my cleaning cart from the supply room, and started my rounds on the 4th floor, medical surgical unit. Room 412 had been discharged that afternoon. I needed to deep clean it for the next patient. I unlocked the door, turned on the lights, and saw her. A woman, maybe 60 years old, lying in the bed, transparent like she was made of glass or water. I could see through her to the pillow beneath. She had an IV in her arm, oxygen in her nose, monitors beside the bed showing vital signs, but the room was empty. The bed was stripped. There was no IV pole, no monitors, no patient. I blinked hard, shook my head. The woman was still there. I could see her chest rising and falling with breath. I could see the monitor displaying heart rate, blood pressure, oxygen levels, all on equipment that wasn't actually in the room. I backed out of the room, heart pounding, closed the door, took a deep breath. Maybe I was overtired. Maybe I needed new glasses. Maybe the long nights were finally getting to me. I opened the door again. She was still there. A ghost patient in an empty bed. I approached slowly, watching her. She didn't acknowledge me. Patients rarely notice the cleaning staff anyway. Her eyes were closed. The ghostly monitor showed steady vital signs. The transparent IV drip chamber showed fluid flowing. I reached out to touch the bed rail. My hand passed through the ghost equipment and touched real metal. The patient was there and not there simultaneously. Present in some reality I could see but not touch. I cleaned the room around her, which felt absurd, mopping the floor under an invisible occupied bed, wiping down surfaces while ghost monitors displayed vital signs. The whole time she lay there, breathing, existing in a reality 12 hours ahead of mine. When I finished cleaning, I checked the room assignment board at the nurse's station. Room 412, empty, ready for next admission. I continued my rounds, but I couldn't stop thinking about what I'd seen. Hallucination, some kind of residual image, a trick of exhausted eyes. The next morning, September 9th at 6 a.m., I clocked out. Before leaving, I walked past the fourth floor. Room 412 now showed occupied on the board. I peeked through the door window. There she was, the same woman I'd seen the night before. Same age, same appearance, same position in bed. But now she was solid, real, with actual equipment, actual monitors showing the same vital signs I'd seen in ghost form 12 hours earlier. I felt cold all over. I'd seen this patient before she was admitted, before she even knew she'd be here. I told myself it was coincidence. Maybe I glimpsed her during admission, and my tired brain had created a false memory. But I knew that wasn't true. She'd been in that room, transparent and ghost-like, hours before she physically arrived. On September 11th, Monday night, it happened again. Room 307 was empty, freshly cleaned. When I entered to mop, I saw him, a young man, maybe 25, with severe injuries. Ghost versions of trauma equipment surrounded him. His transparent form showed bandages, tubes, monitors. I could see dry blood on ghost gauze, emergency interventions in progress, but the room was empty, clean, ready. I checked the assignment board. Room 307, empty. The next morning, room 307 was occupied. Same young man, motorcycle accident, admitted at 3 a.m., exactly as I'd seen him 8 hours earlier when the room was still empty. I started keeping notes. Every night I documented which rooms had ghost patients, what they looked like, what equipment surrounded them, what their monitors showed. The next morning, I checked the assignment board and patient roster. The correlation was perfect. Every ghost patient I saw at night was admitted within 12 hours. Same room, same appearance, same injuries or illnesses. I was seeing the future hospital census before it happened. By September 20th, I documented 15 ghost patients, 15 accurate predictions of who would be admitted, to which rooms, with which conditions. The phenomenon was consistent. Between midnight and 4 a.m., the quietest hospital hours, empty rooms would fill with ghost patients. Some appeared for just minutes before fading. Others remained visible for hours, but all of them became real patients by the next day. I didn't tell anyone. Who would believe a night shift janitor saw a ghost patient? I'd be sent to employee health, probably fired for mental instability. I kept my observations private, documented them in a notebook I carried in my cleaning cart. But on September 23rd, I saw something that forced me to act. Room 551 was empty. I entered to clean at 1:47 a.m. The ghost patient appeared immediately. A little girl, maybe 7 years old, in severe distress. Her transparent form showed breathing tubes, emergency equipment, crash cart nearby. The ghost monitors displayed dangerously abnormal vital signs, rapid heart rate, low oxygen, unstable blood pressure. This wasn't a stable patient waiting for admission. This was a child in critical condition, dying. I watched helpless as ghost doctors and nurses worked frantically around her transparent form. I saw them performing CPR on ghost equipment. I saw monitors flatline and revive. I saw a child fighting for her life in a room that was still officially empty. The ghost scene faded after 30 minutes. The room returned to empty stillness, but I knew what I'd seen. Somewhere in Seattle, within the next 12 hours, a little girl would arrive at this hospital in critical condition. And based on what I'd seen, she might not survive. I went to the nurse's station on the 5th floor. The night charge nurse, Maria Santos, was doing paperwork. "Excuse me, ma'am, I need to report something." She looked up, surprised. In 22 years, I'd rarely spoken to nurses except to ask about room cleaning priorities. What is it, Sarah? Room 591. I think there's going to be an emergency admission. A little girl, respiratory distress, very critical. Maria frowned. How do you know that? I have a feeling, strong feeling. I think you should prepare the room for a pediatric respiratory emergency. Have equipment ready. Sarah, we can't prepare rooms based on feelings. We'll set up when we get the call. Please, I'm never wrong about these things. Just trust me. Maria studied me. Maybe she saw something in my face. Desperation, certainty. Okay, I'll have respiratory therapy. Check room 521. Make sure emergency equipment is functional. But I can't pull staff to prepare for a patient who might not come. Thank you. That's all I'm asking. At 4:23 a.m., the call came. 7-year-old girl, severe asthma attack, not responding to home treatment. Ambulance en route. ETA, 15 minutes. Assigned to room 521. Maria looked at me across the nurse's station. How did you know? I told you. I had a feeling. The girl arrived at 4:38 a.m. in severe respiratory distress, exactly as I'd seen in the ghost version. But because Maria had listened to me, because respiratory therapy had checked the equipment, because they were mentally prepared, the response was faster. They stabilized her quickly, got her on the right medications, supported her breathing. She survived. If they'd been unprepared, scrambling for equipment, those extra minutes might have made the difference. Maria found me during my morning cleanup rounds. Sarah, that little girl, is stable now. The doctor said another 10 minutes without proper treatment, and she might have coded. You saved her life by giving us advance warning. How did you know? I can't explain it. I just knew. Can you do it again? See other emergencies coming? Sometimes, not always. It's not reliable, but it was reliable. Every night I saw ghost patients, and every day they became real. On September 28th, I saw a ghost patient in room 214, an elderly man having a massive stroke. I reported it to the night nurse, Kevin Park. He didn't believe me, but made a note. At 5:17 a.m., the exact patient was admitted with acute stroke. Kevin looked at me like I was psychic. On October 3rd, I saw ghost patients in rooms 318, 425, and 507, 3-car accident victims from the same crash. I reported it. At 2:34 a.m., a 3-car collision on I-5 sent those exact victims to those exact rooms. The night staff started to notice. Nurses would ask me, Sarah, do you see anything tonight? Any feelings about emergencies coming? I do my rounds, check the empty rooms, report which ones had ghost patients. My accuracy became legendary. Sarah knows became shorthand for preparing for incoming patients. They didn't know how I knew. They assumed I had some kind of sixth sense, some intuition developed over years of night shifts. But it wasn't intuition. I was literally watching tomorrow's patients 12 hours before they arrived. On October 10th, Dr. James Mitchell, the night attending, pulled me aside. Sarah, the nurses tell me you've been predicting patient admissions with remarkable accuracy. How are you doing it? I don't know, doctor. I just noticed things. Are you accessing the EMS radio system, listening to ambulance calls? No, sir. I don't have access to that. Then how are you consistently predicting who's coming in, what rooms they'll need, what conditions they'll have? I couldn't tell him the truth. I've worked nights here for 22 years. You learn to read patterns, anticipate needs. He didn't look convinced, but he didn't push further. Well, whatever you're doing, it's helping. Several patients have received faster treatment because we were prepared. Keep doing it. But on October 15th, I saw something that terrified me. Room 403 was empty. At 2:14 a.m., the ghost patient appeared, a middle-aged man, maybe 45, in severe distress. But this ghost patient was different. The equipment around him showed failed resuscitation. The monitors flatlined. Ghost doctors performed CPR, but eventually stopped. I watched them cover his transparent body with a sheet. I was seeing a patient who would die, not just arrive in critical condition, actually die. The ghost scene played out over 20 minutes, then faded. But the message was clear. Within 12 hours, a man would be admitted to room 403 and would not survive. Could I prevent it? If I knew he was coming, if I warned the staff, could we change the outcome? I went to Maria, who was working the 5th floor again. Room 403, male patient, mid-40s, heart attack. He's going to code. You need your best team on that room. Sarah, we don't even have a patient assigned to 403 yet. You will, and he's going to need everything you have. Please trust me. Maria must have seen something in my face because she nodded. I'll make sure our strongest team is ready. At 6:42 a.m., just before my shift ended, a 44-year-old man named Robert Davis was admitted to room 403 with a massive myocardial infarction. Because Maria had taken my warning seriously, the cardiology team was ready. They worked on him aggressively, didn't give up. He survived, went to ICU, eventually recovered. I'd seen his death, but by warning the staff, by preparing them, we'd changed the outcome. That's when I understood the full weight of what I was seeing. These weren't just predictions. They were possibilities, futures that could be altered if someone acted on the information. But that also meant every ghost patient I didn't report, every warning I didn't give, might result in a preventable death. On October 22nd, I asked to meet with Helen Rodriguez, the hospital's director of nursing. She was surprised. Custodial staff rarely request meetings with administration. Mrs. Rodriguez, I need to discuss something unusual. I've been predicting patient admissions with very high accuracy. I've heard about this from the night staff. They say you have remarkable intuition. It's more than intuition. I see things. I see patients before they arrive. What do you mean you see them? I chose my words carefully. When I'm cleaning empty rooms at night, sometimes I see images of patients who will be admitted. I see what condition they're in, what equipment they'll need, and it's always accurate. Helen studied me. Are you claiming some kind of psychic ability? I'm not claiming anything. I'm telling you what happens, and it's helping patients. Faster response times, better preparation, lives saved. Sarah, I appreciate that you care about patient outcomes, but we can't make clinical decisions based on visions or intuitions or whatever this is. But it works. Ask the night nurses, ask Dr. Mitchell. My information has been consistently accurate. Even if that's true, we have protocols. We can't justify pre-positioning staff and resources based on one custodian's feelings about which rooms will be occupied. Even if it saves lives, even then, I'm sorry, Sarah. Continue to share your observations with the night staff if they find it helpful. But understand that it can't be formalized or made official hospital policy. I left that meeting understanding my place in the hospital hierarchy. I was useful but not credible. My information was valuable but not legitimate. I could save lives from the shadows but never receive recognition or authority. On November 1st, I saw the ghost patient who would haunt me for months afterward. Room 611 empty. At 1:53 a.m. she appeared, a teenage girl, maybe 16, with severe trauma. Ghost equipment showed she'd been assaulted, beaten badly. I could see ghost doctors working frantically, ghost monitors showing critical vital signs. But this ghost scene was different. I saw police officers in the room taking statements. I saw evidence collection. I saw a forensic nurse conducting examinations. This wasn't just a medical emergency. This was a crime scene, and it hadn't happened yet. I knew I should report it, warn someone, but what would I say? In 12 hours, a beaten teenage girl will arrive, and you should have police ready. How could I explain knowing that? I agonized over it for hours. Finally, at 4 a.m., I called the hospital security office. This is Sarah Johnson, custodial staff. I need to report a concern. I think we might have a serious assault victim coming in soon, a teenage girl. I can't explain how I know, but I think you should have someone ready to assist with a potential criminal case. The security officer was skeptical, but made a note. At 7:23 a.m., paramedics brought in a 16-year-old girl who'd been assaulted by her stepfather. She was placed in room 611 exactly as I had seen. Police were called. A forensic nurse was brought in. Evidence was collected. Because I'd warned security, they'd already contacted the police department's domestic violence unit. An advocate was ready. The response was coordinated, professional, faster than it would have been without preparation. The girl survived. The stepfather was arrested. The case was prosecuted successfully. I'd seen a crime before it happened and given a victim a better chance at justice. But I'd also crossed a line. Hospital security wanted to know how I'd known. They questioned me for 2 hours. How did I know about the assault? Did I have information about the perpetrator? Was I somehow involved? I told them I'd overheard something. A rumor, couldn't remember from who. They didn't believe me, but couldn't prove otherwise. Helen Rodriguez called me in again. Sarah, security tells me you predicted another admission. This time, a crime victim. They're concerned about how you're getting this information. I already explained. No, you didn't explain. You said you see patients before they arrive. That's not an explanation. That's a claim of supernatural ability. Does it matter how I know if the information helps? Yes, it matters if you're accessing confidential patient information somehow. That's a HIPAA violation. If you're listening to police scanners or EMS channels without authorization, that's a security breach. If you have some other source of advanced information, we need to know what it is. I don't have a source. I just see them. Then you're claiming psychic powers, which means you're either mentally unstable or running some kind of scam. Either way, I have to take action. On November 8th, 2023, I was placed on administrative leave pending investigation. 22 years of excellent service ended because I tried to help patients using an ability no one could explain or believe. They investigated my computer access. I barely used computers. They checked if I had unauthorized radio equipment. I didn't. They interviewed staff, asking if I'd been overheard accessing privileged information. Everyone said I kept to myself, did my work, never caused problems. The investigation found no evidence of wrongdoing, but they also couldn't explain my predictive accuracy. The final report concluded, employee demonstrates unusual knowledge of incoming patient, source unknown, no policy violations identified, but continued employment poses potential liability risk. On November 20th, I was offered a transfer to day shift, different department, no patient contact, essentially demoted and sidelined. If I refused, they'd find a reason to terminate me. I refused. On November 27th, 2023, I was terminated from Harborview Medical Center. The official reason was restructuring of custodial staff. The real reason was that I'd become a liability, someone who knew things she shouldn't know in ways they couldn't understand. I collected my final paycheck, turned in my badge and key, and walked out of the hospital I'd cleaned for 22 years. For weeks, I struggled with what to do next. I was 55 years old, unemployed, with a reputation that would follow me to any hospital job. The janitor who claimed to see ghost patients, but I couldn't stop thinking about the lives saved. The little girl with asthma, Robert Davis, and his heart attack, the 16-year-old assault victim, all because I'd seen them coming and warned someone. How many patients would suffer now because I wasn't there? How many emergencies would catch staff unprepared? How many deaths might have been prevented if someone had 12 hours warning? In January 2024, I got a job at a nursing home. Lower pay, no benefits, but they needed night shift cleaners and didn't check references carefully. On my first night, I saw them, ghost residents in empty rooms, transparent figures in beds that would be filled within hours. I was still seeing 12 hours into the future, even in this new facility. An elderly man who would fall and break his hip at 3 a.m., a woman who would have a stroke during the night, a diabetic resident whose blood sugar would crash dangerously. I reported what I saw to the night nurse. She looked at me like I was crazy but made notes. When everything happened exactly as I predicted, she started listening. How do you know these things? She asked. I just noticed things. 20 plus years of night shift work. You develop instincts. She didn't press further. She was just grateful for the advance warning that let her prepare, respond faster, prevent complications. I'm still working night shifts, still cleaning while others sleep. I see ghost patients in empty rooms, ghost residents in beds that will soon be filled. I give quiet warnings to whoever will listen. Help where I can, save lives from the shadows. I'll never get recognition. I'll never be believed by administration. I'll always be just a janitor, invisible infrastructure, part of the background that keeps hospitals running. But I see what's coming. I see tomorrow's patients tonight. And as long as I can give warning, as long as I can help prepare for the emergencies I foresee, I'll keep doing this work because someone has to be there at 2 a.m. in the quiet hours, watching the empty rooms filled with ghost images of tomorrow's suffering. Someone has to bridge the gap between now and soon, between empty and occupied, between unprepared and ready. I'm 55 years old. I've spent my adult life cleaning up after others, invisible to those I serve, but I see what they can't see. I know what's coming before it arrives, and that makes me the most valuable person no one believes. The night shift janitor who sees tomorrow, the 12 hours at a time.